Okay, dear students, today the topic is conjunctivitis, and this we are studying in the topic in the subject that is pharmacotherapeutics. Okay, Form D. So conjunctivitis and overview and management. So here I will just in a concise manner I will guide you about what is conjunctivitis, what are the different types of conjunctivitis. Okay. So let us go to the second slide. What is conjunctivitis? We all know that many times after seeing this picture, you can come to a conclusion that it is related to some kind of reddish eye. Okay, by seeing this picture. So conjunctivitis also means also referred to as a red eye and is an inflammation or infection of the conjunctiva, which is a very thin transparent tissue which covers the white part, that is the sclera of our eye, and the inner surface of our eyelid. So sometimes what happens, the inflammation occurs, that is marked as the redness, swelling, pain. Okay, all these symptoms generally occurs with the inflammation, and it can be caused by different reasons are there, but sometimes it is caused by the viral infection, sometimes it is a bacterial infection, sometimes it is because of the allergens. Okay, some like pollen grain, dust particle, or the irritant like cold air, hot air. Okay, that may also sometimes causes the conjunctivitis, and the symptom occur, that is the redness occur in our eye, the swelling occur, the irritation occur, the watery and mucus discharge occur, and the sensitivity to the light also occur. Okay, so viral conjunctivitis is the most frequent form and often associated with cold or respiratory infection, which is highly contagious, means it can be transferred easily from one person to the other person. Then these are the classification. Three different types of conjunctivitis are there. That is the bacterial conjunctivitis, viral as well as allergic. So in bacterial, what is present? The bacteria, that is Staphylococcus aureus or the Staphylococcus pneumoniae are the chief cause for bacterial conjunctivitis. Then viral conjunctivitis, that is the adenovirus, and maximum 80% of the infection occur because of this virus, that is the adenovirus. And then allergic conjunctivitis, which occur because of the allergens. Many people are allergic towards the pollen grain, dust particle, or the pet danders, means the hair, small hair of the pets, like cat, dog, which are present in our houses. When they move inside our house, small, their hair falls down, and that hair, with the help of the air, with the help of the fan, with the help of the air condition, they move inside the atmosphere, and when they it goes inside the eye, probably it causes the allergic conjunctivitis. Then the discharge, it is thick purulent. Purulent means a colorful type of thick whitish purulent discharge takes place, means yellow green color discharge from the eye takes place, and crust on the lashes, eyelashes generally is formed. But in viral conjunctivitis, this discharge is not a purulent type, means a colorful type, it's a watery, clear and thin color. And then in allergic, it is stringy and it contains some amount of mucus. That's why we call it as a mucoid type of mucoid type of discharge. Then onset, sudden onset takes place after the eye is infected with Staphylococcus aureus or pneumonia, and gradual onset often after the cold or the flu. Okay, and seasonal or linked to the allergen exposure. If our body is exposed to the allergen, probably we may get the allergic conjunctivitis. Okay, contagious, it is highly contagious, but viral, it is very much extremely contagious, means it can be easily transferred from one person to other. And allergic conjunctivitis is not, you can say, the contagious, it may not be transferred, because actually the cause is not the viral or the bacteria, but actually it is the allergy that is caused by pollen grain, dust. Okay, probably the dust is, when it goes inside the eye of one person, is causing the conjunctivitis, mean inflammation in the conjunctiva, but the same dust may not cause any kind of allergic reaction in the other person. For the same, this is not very much contagious. Then redness, it is generalized red, and then mild redness is present. Then other symptom is swelling, discomfort, mild pain occur in the bacterial conjunctivitis. In viral, irritation, watery eye, and possible photophobia also occur, means when the person goes inside the sunlight, ultimately what happens, he is unable to completely open his eye, so with the light, ultimately he feels difficulty in seeing. That's why generally doctor says that, or as a precaution, we generally use a black color goggles, okay, in order to cut the photophobia. And in allergic conjunctivitis, because it is an allergic, so itching will be there, tearing will be there, and the eyelid will be swollen down. Affected eye, how it generally affect, that it often start in one eye and spread to the other, and same way it viral conjunctivitis is often start in one eye and spread to the other, and from one person it can spread to the other person. And allergic conjunctivitis, typically what happens, both eye are affected simultaneously. Okay, then the duration 7 to 10 days, may resolve with or without treatment. Okay, means within 7 to 10 days, and the bacterial conjunctivitis can be treated, and viral conjunctivitis 7 to 14 days. Self-limiting means both are self-limiting. Okay, if you will not use any kind of antibacterial antimicrobial agent, then our own immune system will slowly destroy this virus. Means the T cell and B cell will produce the B cell will produce the antibody, and T cell, cytotoxic T cell, will kill this bacteria as well as the viruses, and ultimately the eye will be cured out. But sometime what happens, we take the antibiotics or antiviral medicines or eye drop in order to speed up the recovery, so that ultimately it may not take more than 1 week, and with less than 1 week the viruses or bacteria may be killed out, so that the recovery may be fast. Okay, then treatment, antibiotic drop or ointment we generally take in the case of bacterial conjunctivitis. Okay, and in symptomatic, artificial tear and hygiene is being maintained, and here in the mast cell stabilizer we take in allergic conjunctivitis, or the antihistaminic medicine we generally take. Then diagnosis, okay, that is the symptom for red eye, that is symptom, pain or photophobia is present. Okay, if the same pain or photophobia is present, yes, then chances is there that it is a condition of possible uveitis or acute narrow angle glaucoma or keratitis or other. Okay, and the patient should be referred toward the ophthalmologist for further diagnosis. If there is no pain or photophobia, and then sign of discharge is there, means something is coming out from the eye, then we will go for that. If the discharge is there, okay, then we will check out that if there is no discharge and only itching is there. Okay, then we will check out that there is, yes, itching is there, yes, then it is a condition of allergic conjunctivitis. Means no discharge, no pain, only itching, then it is a condition of allergic conjunctivitis. But if there is no discharge and then in itching there is no itching, okay, means it is a condition of dry eye, topical drug toxicity or other substances are there, and we will treat it with different type of medications. Okay, and then discharge, if the discharge is yes, then we can say that which type of discharge, whether it's a purulent discharge or whether it's a watery discharge. If it is a purulent discharge, yes, it means that it is a condition of bacterial conjunctivitis. If there is no purulent discharge, means green or yellow color discharge is not there, then we will check out that whether it is a watery discharge. Okay, watery discharge is there. If it is yes, then it is only a watery discharge. If an itching, got it. So if there is an itching, it means that it is a condition of allergic conjunctivitis. If watery discharge is there and there is no itching, it means that it is a condition of viral conjunctivitis. Got it. And then if the purulent discharge, yes, bacterial conjunctivitis, then abrupt onset of copious purulent discharge, rapid progression is there, there is no, it means that it is a condition of bacterial conjunctivitis only. If yes, means bacterial conjunctivitis is there, along with abrupt onset is there, copious purulent, then it is a condition of hyperacute bacterial conjunctivitis. Okay, so in this way we can just identify that which type of conjunctivitis is present. Means itching is present, no other symptom, it means that it is a condition of allergic conjunctivitis. If there is a purulent discharge, means colorful discharge is there from the eye, then it means that bacterial. And if watery discharge is there, it means that viral conjunctivitis it is there. Okay, so by this we can identify. Then these are all those bacterial conjunctivitis which we have already gone through there. Okay, general approach, and then come to the treatment. Okay, what are the treatment we generally gives? Okay, in the bacterial conjunctivitis. Then viral conjunctivitis, same way. Okay, then comes the last topic. Here, what happens for the treatment? Pink eye conjunctivitis types and the treatment. Antihistaminic eye drop, we give it for allergic conjunctivitis. Steroid eye drop for allergic conjunctivitis, and then OTC, artificial tear, for dryness. If the eye is dry, we give this one, that is in allergic conjunctivitis we can give artificial tear and cool compress, so that we can give a soothing effect to the eye. In bacterial conjunctivitis, we don't require any kind of antihistaminic because it's a bacterial infection, and so we give the antibiotic, artificial tear, and cool compression, and NSAID is also given in order to reduce the inflammation. In viral conjunctivitis, what happens? We reduce the inflammation, steroid eye drop, because we all know that steroid generally has an anti-inflammatory property, and then artificial tear, cool compress, as well as antiviral medication. Okay, here antibiotic is being not prescribed. Antibiotic is not prescribed because they are ineffective against the viral infection. Treatment of other form of conjunctivitis, that is neonatal conjunctivitis, in which small children are there, okay, which may get infected and like cause a sexual transmitted disease like chlamydia, gonorrhea transmitted during the birth. Means if the mother is suffering from gonorrhea or chlamydia, that is sexual transmitted disease, during the childbirth, in their eye this Neisseria gonorrhoeae or the causal organism chlamydia may enter into the eye and may cause the conjunctivitis inside the eye. So for that we will give IV antibiotic or oral antibiotic. Okay. Toxic conjunctivitis means prolonged or early use of preservative containing eye drops. If a person is taking, it may lead to the toxic conjunctivitis. Okay. Irritant conjunctivitis like foreign particle, chlorine or harsh chemical, if it enters inside our eye, ultimately it may cause the redness of our eye. So we can flush the eye with artificial tear, avoid rubbing the eye, seek medical condition. Okay. And then giant papillary conjunctivitis, immune reaction to a foreign body, commonly contact lens. Many times we use the contact lens, so sometime our body sense this contact lens as a foreign body, and in response of that our body generally tries to seek to our immune system try to identify this contact lens as a foreign substance and initiate a immune reaction like stimulation of T and B cell, and then that may cause the allergic reaction. They may stimulate the release of histamine, and ultimately the allergic reaction may start. So discontinue lenses for at least 1 month, switch to daily disposable lenses. Okay, prescribe mast cell stabilizer, because mast cell will stabilize the mast cell. Ultimately the mast cell will not burst, release of histamine will not take place, and conjunctivitis will not be conjunctivitis symptom will not be appearing at that time. Okay, so these are the four different type of other conjunctivitis apart from viral, bacterial, as well as allergic conjunctivitis. This is the normal eye and this is the conjunctivitis eye.